fact that pelvic floor information is actually equally of concern to both men and women. This is not just a women's issue. It is, and I'm actually going to go through and talk about the male side of this as well, because for those of you with husbands, you may see some of these issues and now you'll understand what's going on for them. So I'm going to cover it in two tracks, both for women specifically and then also for men. The pelvic floor is the set of muscles that sits at the base. um, Underneath it, it supports the anus, the rectum, the bladder, the ovaries, the uterus, all of our organs underneath. And the way you know what your pelvic floor, if you're sitting in a chair, the way you know if what your pelvic floor is, if you contract your buttock muscles and bring everything up and in towards your spine, you're going to feel the pelvic floor lift. And when you relax, release. And you want to feel that feeling. And that way you know what those muscles are. Your butt cheek shouldn't move and your leg muscles shouldn't move when you contract that muscle. But by lift, kind of like thinking about, I know this sounds terrible, think about holding a fart in. You need to pass gas, you're in an awkward place, and you've got to hold it in. You're doing it with your pelvic floor. Simple as it can be. That's the easiest way to describe it, for better or for worse. So it's important for women, especially over the age of 40, and for men, I would say more so probably over the age of 50, because that's when you're going to start seeing symptoms. Women will definitely have pelvic floor issues much sooner because childbirth is one of the predisposing factors for pelvic floor disorder. It's not the only one, but it's definitely the main one. All right, so the other thing you should know about pelvic floor is that the muscles have two ways they can go when they're not working well. They can be tight or hypertonic, or they can be weak and hypotonic. Women oftentimes are going to see themselves as hypotonic, which means weakness of those muscles. And so at the end of this, I'm going to give you the exercises, the 5 simple exercises you can do at home. And the reason I want to do that is because they address the weakness. And I think more than anything, that is what I think probably 80% of women have weakness over tightness. 1 in 4 women will suffer from pelvic floor disorder in their lifetime for a multitude of reasons. I didn't look for the statistic for men, and I do apologize. I actually thought it and then didn't follow through with it. I have a couple pictures, but I couldn't find a large enough pelvic floor. So just visualize that it's like this cup of muscles that runs from the pubic bone to the sacral or through underneath the tail, where the tailbone is. So it sits underneath everything. So it's like a cup. And that's why you can lift and relax it, lift and relax it. All right. Normal treatments are physical therapy, biofeedback, and lifestyle changes. We're going to talk about the most natural things, obviously, more of the lifestyle stuff. So let me go through and this is specifically for women, though men may also have a few of these. Signs of hypertonic pelvic floor. So that's tight muscles. And you know that you have the tight muscle if you actually don't feel that pelvic floor drop when you relax them, when you contract. and you don't feel it relax, that tells you your pelvic floor is tight. Or if you have tried to do Kegels after, especially after childbirth, getting things back in order after childbirth, and the Kegels actually make the symptoms worse. Those are the two signs of pelvic floor tightness. Other signs: painful sex, pain during or after intercourse and through in penetration, constipation, difficulty with bowel movements, or a constant feeling of tightness, urinary dysfunction, trouble starting a stream, a weak stream, or a feeling like you cannot empty your bladder completely. And I will say, that it sort of feels like, you still have to go, but it takes a few minutes for the stream to restart, like it stops and starts. Chronic pelvic pain, lower back pain, hip pain are also symptoms of tight pelvic floor muscles. And again, failed Kegels, trying to do a Kegel exercise makes symptoms worse. And I'm going to talk you through what a Kegel should be, how it should be done, and the way to find that muscle at the end. So just know I will do that as we move forward. So the signs of a weak pelvic floor musculature include things like urinary leakage. So leaking when you're sneezing, coughing, laughing, exercising, or something they call stress incontinence. Dribbling after you get off the toilet and have wiped. You still have a drop or two. Pelvic heaviness, that feeling of pressure or weight or that dragging down pelvic area, often associated with prolapse. So for example, I've had a patient report that they feel like there's a heavy weight or ball behind their pubic bone, or they feel like something's bulging and they look at their vagina and they can actually see vaginal wall coming through. Decreased sensation is another one that is a symptom of a weak pelvic floor. And they have during intercourse, there's a diminishment of sensation. Silly thing, inability to trouble holding back gas or feces. I was going to say one more thing in relationship to that, and it'll come back to me because I know it's further down in my notes. Signs of pelvic floor. Oh, I know what I was going to say. Pardon me. Oh, did I grab my glass? No, I didn't. Um, you can have both tight and weakness at the same time. That's what I wanted to say. So one condition doesn't rule out the possibility of the other condition. And don't ask me how those two things can be the same in the same place, tight and loose, because I have a feeling it's a much more deep issue, and the treatment for the tight musculature is a little bit different than the weak. So when I did some in-depth reading, which is a little bit beyond this particular, because it requires a pelvic floor specialist to do. So it was a little bit beyond this particular educational process. Okay, moving on to pelvic floor for men. Pain, chronic pain, pelvis, perineal area, and the perineum is that space between basically the vagina, the back of the vagina, or the scrotum and the anus. That's the perineum. Every woman knows what it is because if they've had a child, they've had a C-section, that's where they cut to have a C-section. But for men, they don't usually have any concept of what the perineum is. So it's a good thing to describe where it's located. Urinary issues, frequency, urgency, hesitancy, or a slow interrupted stream. Now, I will say a slow interrupted stream those can also be symptoms of prostatitis or an enlarged prostate gland, but it's a good thing to look at pelvic floor even before you look at prostate. Sexual dysfunction, painful ejaculation or premature ejaculation, inability to relax, muscles feeling constantly clenched, especially when stressed. Signs of a weak or underactive or hypotonic pelvic floor in men specifically, leakage, urinary or fecal leakage, um, difficulty holding back, same as it is for women. That gas, for example, I have no control over whether they can hold their gas or not. Post-void dribbling, urine leaking out after leaving the toilet. Sexual dysfunction, erectile dysfunction, or weak ejaculations. Lack of endurance, inability to hold a contraction Kegel for more than a few seconds. Um, and that applies from an ejaculation standpoint for men. They can't, when they don't have any ability to hold back on ejaculation. Sorry for the details, ladies. Heaviness or fullness or pressure in the pelvic area, just like it is for women. All right, how to differentiate for yourself. I want to go through this right now. So try to relax. If you can't intentionally relax your pelvic muscles, where you feel as if your butt cheeks, your tailbone, so if you're sitting in good posture, so you're sitting on your ischials, which are the two little bones on your pelvis. So you're sitting slightly forward. Think of it like in a completely upright. So your hip bones, your shoulder bones, and your ears should all be lined up. That's sitting comfortably neutral. Your chin should be in, not out, looking at me on the screen. That's the other thing I would say. So if in that state you don't feel relaxed in your perineum, it's possible that your pelvic floor is tight. And there is a stop test, actually. A weak floor, oh, they're looking at that's two. Let's just go ahead. So Kegel check. So while you're sitting, I'm going to go ahead and do the Kegel check while we're right here. Kegel check. So sitting in the firm chair and try to tighten the pelvic muscle, like I said earlier, holding back gas is the best way to describe it. A weak floor will feel hard to lift and hold. So you should be able to lift that floor and hold it up to 30 seconds easily. If you start noticing at 10 seconds, your anus starts relaxing, then you've got weakness in that pelvic floor. So that's the thing I would say. You may not realize that the pelvic floor drop is the musculature. For you, that sensation might be, I can't keep my rectum closed, my anus closed, like I'm holding back that fart. So that's the way to check it. A tight floor often just feels like it never actually relaxes you. I'm going to use a funny example. So when you ride a horse and you're sitting in the saddle, the horse can feel if your butt cheeks are tight, if your pelvic floor is tight. And I was riding with a friend and I was nervous, and she was riding behind me and she said, Suzette, relax your butt cheeks. I can see it. Copper can feel it. You're bugging him. So I know that's an example for not all of you have ridden a horse, but it's a good way to think about relaxing your butt cheeks. So if you're one of those people that you know that you tend to hold a lot of tension in your butt, because shoulders and butts are the two places that human beings most often hold tension. And then the next place is going to be the diaphragm. right? That's where we hold it when we're anxious, uptight, worried. We tend to clench. Think of it that way. I think she might have used that word. Quit clenching. So there you go. That's the way to know the difference. If you're not sure, a professional assessment by a pelvic floor specialist is the best way. The problem is, for most of us, the way the insurance runs our healthcare, getting into a pelvic floor specialist is near impossible. So therefore, our self care becomes critical mass because oftentimes we go into the doctor and we let them know we're having these kinds of issues where we feel like our urinary stream, or we can't void completely when we're going to the bathroom, or we don't have control. And they kind of look at you and say, well, it's just because you're getting older. So it's part of menopause, or, they don't pursue it. And we live with these symptoms that we could probably clear up in 3 to 6 months of just consistent pelvic floor exercise and conscientiousness. So I encourage you to share this kind of information with people. Let people know that they can resolve it. If you hear one of your friends talking about any of these symptoms, male or female, that they certainly can be resolved. So again, the Kegel check, and if you don't know what a Kegel is, the best way to find your Kegel is actually sitting on the toilet and peeing. Now, it is not good to Kegel while you're peeing, but if you don't know how to do a Kegel, the way a Kegel works is you stop your urinary stream midstream. And you can check how strong your pelvic floor is by doing it at the beginning of the stream when there's more force. You just don't want to do it on a regular basis because it creates a problem with voiding. So, but if you don't know what I'm talking about, what that sensation is, get on the toilet next time you pee and take the time to check it. Can I stop my urinary stream? If you can't, that's clear on weak muscle, because you should be able to stop your urine, and it should be able to happen unless your like bladder is overloaded. It's you've been using the 8 hour bladder hold model because you've been driving, flying, or lecturing. Um, you should be able to stop it at any point during the stream. So that's the way to test it. The other thing is there's a breathing test. So if you take a deep breath and you know how to breathe correctly, where you're breathing, your breath isn't in your shoulders, it's in your abdomen, right? When you take a deep breath, your belly goes out, your rib cage um, and your diaphragm actually drops. So that's what your rib cage goes in, your diaphragm drops. And that's what gives the lungs that creates the negative pressure, and then the oxygen fills the lungs. That's how the breath works. When you exhale, it's you're going to contract your chest, but your shoulders should not rise as a part of that. So as you inhale, your pelvic floor should relax and expand along with your abdominal muscles and your diaphragm, allowing for that air to be sucked in and pulled all the way to the bottom of your lungs. So if you don't feel your perineum dropping during that inhale, then there's a problem. And it is usually tight. All right, I want to do one more thing here. Make sure I've got them all. Okay, I think I got them all. All right, so causes specifically, what are the factors that put men and women specifically at risk for pelvic floor disorders? So childbirth is the number one trigger for women, but it's certainly not the only trigger. And it's because of what happens during childbirth and the expansion of the pelvis, um, and the sacrum and everything that has to move and make room for that baby to be delivered, so that all the connective tissue in the pelvic floor definitely is impacted by giving birth. It's sort of cumulative. So if you've had more than one child, it's definitely gets worse with each child. And if you gave birth to children, or to in you know a newborn at over 8.5 pounds, it definitely predisposes you. You're at higher risk for pelvic floor disorders. Let's just put it that way. Consistent pressure on your pelvic floor is another predisposing, from being overweight, from constant chronic constipation, if you've had to strain for a bowel movement, from heavy lifting. Like I have ladies that, they huck bales of hay that can weigh half a ton and stack it. Those kind of individuals. People who do weightlifting and don't do weightlifting correctly can also trigger pelvic floor disorders. Um, Chronic coughing can also trigger pelvic floor disorders. And if you think about it, it makes sense. As we get older and our estrogen changes, our muscle tone and our collagen changes, it frequently causes pelvic floor muscle weakness, which is why your doctor will say to you, it's just part of menopause. There's nothing you can do about it. Until you're having to use depends, let's just put it this way. Weak tissues due to genetics. So there are women who haven't had children, haven't done heavy lifting, don't have chronic constipation, and they still end up with a pelvic floor disorder because of their genetics. They just literally came in with connective tissue weakness, and it has predisposed them for these issues. I still believe that there's oftentimes constipation issues because our Western medicine will tell you that going 3 days without a bowel movement is perfectly normal. And I, one of the things for men, which I will cover, is riding a bicycle, pelvic floor disorder. And in part because the way the bicycle seats sit and the way a man sits on it, it's literally pressing on the perineal nerve, which often triggers erectile dysfunction also. So people who do men especially, who do a lot of cycling, definitely find they end up with pelvic floor disorders.
Like
I
the
think the
movement of the
motorcycle,
legs.
I think there's more up. It's first of all, it's a more upright position. They don't lean forward. Think about most bicycle,
Uh-huh.
especially road biking. You're leaned forward, um, and you are sitting on a very narrow, hard seat. So, which is why they have, and I don't think you have that issue on a motorcycle. So,
Okay.
it's why, in part, they've developed bicycle seats that now have a slit in the center or a little, you know, half moon that leaves a gap. So there's not pressure point directly on the perineal nerve for men.
Oh, that's cool.
Yeah, so they have it's such an issue that that they have adapted those seats from a design standpoint. Men also, heavy weights, weightlifting, chronic constipation, all the same things except for childbirth, but bicycling often is the thing that triggers it. And as men get older, they too go through hormonal changes that can trigger weakness in the muscle. And we in general in our culture tend to be less active as we get older. And one of the predisposing issues is that we are at computers sitting in awkward positions, not ergonomically correct for much of the day. So if we're working on computers, that kind of thing. So be aware that men too have chronic constipation, coughing, chronic cough. So if somebody's got asthma or any kind of a lung disease, they can be predisposed for pelvic floor disorders. I will tell you though, I have had, because I've been inadvertently and unknowingly coaching people through this for so many years, I I'm amazed at how much recovery can happen with just a little bit of focused effort on this condition. So don't feel as if you can't repair it. Every single time I have, especially women come to me, not men so much, but women come to me and they tell me that their doctor has just told them they'll have to start wearing a pad until it's too bad. I mean, that if you push hard enough, they'll give you a medication that will um, help manage the irritability of the bladder, so for the frequency of urination. But that's not a pelvic floor issue. That's an irritation of the bladder. So it's all of those medications have side effects, and it's a good idea to start with the least invasive and move to the most invasive. I was actually thinking about this today. What do I stand for? I stand for starting with what's natural first, least invasive, if you have the option to do so, and then moving to a more invasive approach for treatment and therapy. But the bigger difficulty is that women's complaints tend to get dismissed. And I used this recently. I was telling someone recently, I asked the primary care practitioner when we were living in Arizona for a cardiovascular screening of my husband, and he was in the cardiovascular office in 2 days. I went to a doctor in California and said, I'm a woman of a certain age. It's genetically there. I'm worried that I carry it and that I may need cardiovascular screening. And she looked at me and she said, You can't get one. I said, Why? I said, How do I get one? She said, Because they don't cover women's cardiovascular screenings. And so
Wow.
the only way you're going to get one is if you're having a heart attack and you walk into ER. And I just about fell on the floor. I was so upset when I left there. I can't even tell you. I was fit to be tied because I have all the predisposing things, probably more than my husband did. And all I had to do was say, I want to make sure he's healthy enough to have for sexual function. I just want to make sure his heart's healthy enough. And he was over the age of 65. So there you go. Go figure. And he got screened. So the dismissing of women's health issues is a chronic medical issue. And so it is in part the reason why I am for education as much as I can so women can be their own advocates. And also, when they can't get the help they need, they have tools to at least get started until they can push hard enough. So if you think you have a big problem, push your doctors. But I recently had someone come back to me and tell me they had gone to 2 different gynecologists and could not get into a pelvic floor specialist. They would not help her. It was in part the reason I decided this was the next topic we were going to discuss because it upsets me so much that she couldn't get in because she was the candidate who really needed professional help. And I certainly can get her across the finish line, but she shouldn't have to do that on her own. So, so before I go into um, before I go into the exercises, I want to just go through what a Kegel is. And men and women can both do Kegels. So it's just going to feel differently for a man than it does for a woman. So the basic exercise is done by sitting in a comfortable and relaxed position in a chair. Squeeze and lift your back passage as if you're stopping yourself from passing wind. You should be able to feel your pelvic floor muscles move and lift away from the chair. Your legs and bottom muscles should not move, and you should try not to hold your breath at, at all. So you want to be able to do that breathing. Think about it that way. After each squeeze, let your muscles fully relax before squeezing again. Now, there's two types of Kegels that you can do, and one of them is actually, I say there's three. They say in these notes that there's two. There's a short Kegel where you just lift and pull, lift and pull, lift and pull, and a long Kegel where you lift and hold 8 seconds and release. Lift and hold 8 seconds and release. And then I say there's a third, which is called an elevator Kegel, because this is what I have also taught for the last 40 years. And the way that you do that is you lift and hold, lift and hold, lift and hold, lift and hold as far up as you possibly can. And think about it as if your cervix is going towards your belly button. That's what you want to visualize is your cervix moving up your kind of like creeping up your spine towards your belly button. And then hold 8 seconds at the top. Now, the best results, believe it or not, are with that, what I call elevator Kegel. And there, when I give you, there is an exercise that I'm going to show you that I'm going to have you, if you know you have a weak pelvic floor disorder, then I will, when I show you the exercise, I'll give you the modification to do a Kegel with the exercise because it's kind of cool. All right, and then you can check it by just tightening that pelvic floor and then checking to see how long you can hold it. Set a timer and see how long you can hold it, and then relax completely. It's always important in any form of exercise to allow the muscle to relax completely before the next contraction. And one of the things I would say, if we talk about especially mobility exercises, if you contract a muscle and then you release it, the next time you contract it, you're going to be able to contract it more than you could the first time. Because remember, muscles are often partially contracted already, whether it's a leg muscle, an arm muscle, or your pelvic floor muscles. You're always kind of, especially when you're moving, or you're thinking about things and you're engaged, you oftentimes, especially when we're doing something we're completely oblivious or like so engaged in it, if you stop and check your musculature, you're going to notice your pelvic floor is being held tight, your diaphragm is tight, you're not breathing. You know what I'm saying? You're semi-engaged muscularly because you're mentally engaged fully. So it's very important to relax those muscles completely before you contract them again. And that's how you build strength and mobility. Aim for 10 seconds hold and be able to hold it 10 times and try to build the number of repetitions. I had a friend tell me that she uses stoplights when she's driving to do Kegels. I thought that was brilliant. She said it's the perfect time. So every time I'm at a stoplight, I do Kegels while I'm at the or at a stoplight. And I thought, well, that's a way to get it done because she did so much driving in town. So that was a good one. I kept that one. Um, All right. And I wanted to, this, all this information is, some of it came from Cleveland, the Cleveland Medical College, some from the National Health Institute, some from, I pop or Stanford, a little bit of information. They do have a form, and when I get a chance, they have this exercise sheet that they give their clients in the therapist's office that I thought was pretty cool. If you know somebody who needs it, I'll try to get it reworked in a document that I can share because it's such a good one. When you get good at doing pelvic floor exercises, you can do them in the standing position or when you're carrying out other activities such as brushing your teeth or making a drink. It's just really easy to do them. But you have to find your pelvic floor, learn to understand what it feels like when it's engaged and when it's relaxed first. There is an app. I thought this was great called NHS Squeezy App. So it's www.squeezyapp.com. I thought I did not go look at the app. Somebody can do that. I know someone in here will, and then they can let me know what they find. You guys are good at that. The knack technique is when you tighten your pelvic floor muscles before and during certain activities. So, preemptively, this is a good one. And I know they teach this for urinary incontinence. It's called the knack technique, where if you know you're going to cough, sneeze, or laugh, or pick something up, if you have urinary incontinence, you can contract those pelvic floor muscles before you sneeze so you don't leak. The other thing, I've taught this for low back issues. So if you know you're in an acute low back condition, I always say before you sneeze, cough, you know, or even laugh, bend your knees. And if you need to, back up against a wall because you're going to protect your low back while you do that. If you're going to pick something up, you may want to contract the pelvic floor if you know you get leakage at the time that you're picking something heavy up. So the other end, biofeedback is frequently the best way to approach it. The other thing that I would say, both for men and for women, thank you, Maureen, for bringing that up, but is if your quadriceps are tight or the inside muscles in your legs, the interior, there's a couple of long muscles inside, and I'm
The
not going to be able to
adductors?
pull them.
Adductors?
Yes, your adductors specifically. Thank you. That'll work. That general term, those adductors. If those are tight, those frequently will be indicated your pelvic floor is often tight. So having myofascial work done on those adductors will help loosen things up and focusing stretches on the quadriceps. And the other thing I would say is the piriformis, even though that's an internal muscle, there's one where you get on the floor and you stretch internally for low back issues. Doing something like that will make a difference for relaxation. And then just really focusing on releasing those muscles consciously, like when you sit down in a chair, give yourself a cue, just like for the Kegel, my friend used stoplights as a Kegel reminder. Every time you sit down in a chair, just check your relaxation state. Am I clenching my butt cheeks? Because if you are, you don't want them clenched. Release them. You should sit relaxed. And you should have good enough muscle control that you can sit upright comfortably. I have worked at it for years to make sure that I have my diaphragm and my chest lifted every time I sit down and my shoulders relaxed because I catch myself. I work at a computer 4 to 6 hours a day, right? And I'm leaning, the ergonomics are poor. I'm working on a table that's too high, so I can't easily use the keyboard. And I'm leaning forward because I have visual impairment and I don't have the right glasses for repairing that. And all of a sudden, I realized that, oh my gosh, I've got an axe at the base of my neck and I need to get up and move. And I was working on something yesterday and I just looked at my husband and said, I'm going for a walk. I need to go out and move because my shoulders are up around my ear. I've been turtling for 4 hours here today. Oh, it's time to move those muscles. So I did. I went and took a nice long walk. It was perfect. And I came back and I finished what I needed to finish. Yep. Okay, let me make this bigger so it'll be easier for you to see. So this is after all the places I went digging up information so I'd have all in one place. The imaging was so small, so I went and found one pelvic floor. So what I want to show you is the pelvic floor is this set of muscles right here on the man. Can you see where the cross is? Is that big enough to see? And this is what it looks like looking down so that you can see this from Cleveland Clinic. This is a great one. I'm going to move this over just a hair because I'm going to need to. Okay, I wonder if I can do this sideways. Ah, this was the good one. All right, let me see if I can get this down where you can see it. There it is. Here's the muscle. See how this attaches to the tailbone and
Wow.
runs up, up. This is the bladder. This is the pubic bone right here. This white, I should have put a pointer on this, but here's the pubic bone. That's that bony piece in the front. There's your bladder. There's your uterus. There's your anus, your rectum right there. There's your tailbone. The muscle runs from the tip of your tailbone to your pubic bone.
So when you contract that, do you feel it in the bladder, the vagina, uterus, and rectum, like it all comes
Yes, you're going
together?
to feel all of it lift. If you still have
Okay.
them, you're going to feel it lift. I do when I feel it lift.
I mean, because when I hear Kegel, I think of like sexual function, not pelvic floor function, even though it's all connected.
No, no, it's really about pelvic floor
Okay.
function.
Thank you for that clarity.
It really is. All right. Let's start with cat cow. Let's talk exercises. All right. So here's your cat cow. That's as big as I could get it. Sorry, ladies. I think I may end up having to do a video for us one of these days of these exercises. So, believe it or not, cat cow, one of the things I will comment to is the perfect thing for pelvic floor because in cow, which is the first position, you are relaxing the pelvic floor to get into that position, letting your belly drop. When you arch, as you lift your buttocks up to arch your back, you're contracting the pelvic floor to lift the buttocks up. So that's why cat cow works. So that is number one. Number two is, I'm going to do this one, pelvic tilt. So I couldn't find someone in action doing this. So you're laying on your floor, and this is not actually completely accurate. You want make sure your feet are flat on the floor. Your tailbone is flat on the floor. It looks in this image as if the legs are out a little bit too far. I really want them up a little closer to your buttocks. That looks like and someone will come back and correct me, but it looks like they're just a little too far out for my preference. And then you want to feel your spine and your tailbone all sink into the floor before you start this exercise. And then you want to lift it until you're level. So you're lifting your buttocks, you're tightening the pelvic floor in order to do it. It's just like cat cow, as you literally need to lift from the buttocks. Use your buttocks to lift your hips up. So you're not lifting from your abdominals. You're pushing yourself up into a neutral with your, not quite with your knees, but close to neutral with your knees. I will find a better image. That's what I spent 4 hours with yesterday looking for images that I can teach this without doing a
Ask
video.
AI to give you one.
I probably can ask AI to give me one. But what I want to tell you is there is a way to do this exercise that you can do it as an elevator Kegel. And the way that you do it is you start at the tail,
Excuse me.
visualize your tailbone, contract a little bit, and feel your tailbone come off the ground. Think about up rolling up your spine as you're coming up. So you're going to feel L5 and then you're going to feel L4 as you pick your up. So as your tailbone comes up, the next thing you're going to feel is your spine's on the ground. And you're going to roll into L4, L3, which is right in the middle of your lumbars. And as you come up, consciously contracting the pelvic floor is actually lifting that spine off the ground till you hit neutral, hold for 8 seconds, and then the hard part is release it in reverse order. It's if your pelvic floor muscles are tight, this is a great way to focus the relaxation on the way down. So then you think in reverse, and this is really hard to do. I'm going to warn you right now, it's hard to do. I've done it as an exercise because I felt like this was important for me as far as teaching how I was going to teach it. So I used to do it as an exercise. And it's such a great way it opens the spine up. It's a great spine opener for starters, which is what it was designed for originally from a yoga standpoint, was just rolling the spine. And there's more to this if you're doing that from a complete spinal flexibility standpoint. But we're focused on pelvic floor. So just all the way up through the middle of the low back. So if you think about your hip bones being at L3 on your low back, when your hip bones start lifting off the floor, that's really almost as high as you need to be. You don't need to go hard. You don't want to hyperextend the spine because you'll give yourself pain. So the important part is just getting your hip bones off the ground and then slowly, and this is the hard part, slowly releasing that L3 down, and then L4, and then L5, and then your sacral base, and then your tailbone. And relax all the way to the bottom. And if you can do that 2 or 3 times, you will be amazed at how quickly things start to improve. All right, next one is called clamshell. And there's an easy and a hard. So this is the beginner's model of a clamshell. I'm not going to show you the advanced. I didn't bother to download it, but just laying on your side. The lady's feet are together, the inside of her feet, her shoes are together, and then just picking your top knee up and holding and releasing it down, picking it up and rolling it down. It's a pretty simple exercise. And I usually say do 3 sets of 10. And then go to the other side and repeat 3 sets of 10. The next one is a hard one. I've been teaching this for 45 years. It's called bird dog. So, my suggestion is that you start it simply, which is both hands on the ground supported, and you start by picking up one leg and holding it 10 to 12 seconds, and then releasing it, picking up the other leg, holding 10 to 12 seconds. For most of us, our core muscles are not strong anyway because of our sedentary work habits. And because of that, this position is really hard to hold. It takes a lot of balance. I teach it for core and low back. But again, it's a good one for pelvic floor because core muscles are part of what supports a healthy pelvic floor muscle. So, core and pelvic floor are intimately connected. So, by doing core muscle strengthening, you are. So, clam is a strengthener, pelvic tilt is a strengthener, but we're also working pelvic floor. So, if you're a beginner to this, start with just the leg lift and do it for about a week to 10 days, and then you want to do an arm lift. And what I actually recommend is that you don't pick your arm up so far. Arm and leg should be pretty level, and you can look up. If you can look up, it's a good idea. And I want you to note that it's a cross crawl mechanism. So when the left leg is up, the right arm is up, and that 10 to 12 second hold. This is a really, boy, if you have low back problems, this will this particular exercise is one of the best you can do. There you go. All right, there's one more thing I want to tell you in regards to pelvic floor. I mentioned it earlier, and I don't have an image of it. And that is you can I use it for a psoas muscle stretch. And for those of you who've been in the office with low back condition with me, you've heard me give this particular stretch. So I recommend that you do the stretch either next to a couch where you've got an arm you can hold on to, or with a chair pulled out so you've got something that you can help launch yourself back up or stabilize yourself. And the way that you do it is you put one knee down on the floor, and then you extend the other knee, not at a 45, I would say at a 60-degree angle. So 45 is like up and down. You want it slightly forward. The further you extend your heel away from you, the less bend in your knee, the more stretch forward you're going to be able to do. So start with it at 45 and see how you do. See how your flexibility is, because we are stretching the psoas muscle, but a part of that stretch is the quadriceps, the adductors, and believe it or not, the lower rectus abdominis or pelvic, the stomach muscles, the ones that attach between the belly button and the pubic bone. So you're getting a full anterior stretch as a part of this. And what you do is hold on to whatever you're stabilizing and stretch. You literally lean into um, with the bent knee, you lean forward into the outstretched front leg. Does that make sense?
Mhm.
Okay, good. And then you hold for 10 seconds. Do not overstretch. You will hurt yourself. Go to where you feel the stretch and stop. Hold 10 seconds and then come to neutral. Let everything relax, even if you have to bring your heel back in closer so everything feels relaxed, including the pelvic floor, and then extend the leg again and repeat the stretch.
Is it a bit like a lunge, but you're not really lunging? Okay.
Correct.
I just had to
So
visualize it.
if I'm in an airport and I don't feel comfortable getting on the floor in an airport, and I feel like I need to stretch before I get into a seat for the next 10 hours, I do a lunge. That's how I do it. I actually have the capacity to stand on one leg and do a proper, I don't even know what the yoga posture is called, but where you pick up your ankle and stretch back. I can,
Tree or tree post
yeah,
or something?
not tree. Tree is actually a forward one. It's the one where you hold your leg behind you and stretch out arm and leg. I can do that posture and stand on my leg for, a minute. So, um, that works also. So if you have that kind of flexibility and balance, that's a good one. Don't forget to repeat on both sides, and I would recommend that stretch be done 3 times with a complete relaxation in between. So basically, what I've covered are all the low back exercises and core muscle strengthening exercises I offer in my office when people come in and ask for what they can do to strengthen their low back. But mysteriously, because those two pieces, pelvic floor muscle and core muscles, are intimately connected, we also we strengthen our pelvic floor. So any kind of core muscle that you're working with, so whether you're using Pilates or you're doing um, um, uh, I
Plank.
just plank, thank you for that. If you're doing a plank, you are actually working on that pelvic floor. What I was going to say with that clam, the hard one is to where she was on the supported on the floor. You can extend your arm and do that clam in a full yoga posture. So you're engaging the upper body as well. If you want to extend it, it's kind of like the by doing the pelvic tilt, you can do a gentle pelvic tilt, and then you could do it engaged with the roll and the lift. So just just know that. And you can plank, on your forearms. And then you can plank on your hands for a more difficult plank, right? So there's degrees of difficulty. Start with the least difficult degree and then build up as you build strength. And I think that's all I have for pelvic floor information. And I'm happy then to just offer for you, just answer questions so we can go back through. And if there was anything that wasn't clear that might make a difference for you, let me know.
You know the exercise where you kind of go against the wall and you walk up and down the wall? Does that help that area at all? You know what I
Um,
mean?
Facing the wall or
Your
with your
back is
back
on the wall and you're kind of squatting like you
Like a
have a
floor
chair
sit,
there
I
and
mean a
sitting,
wall
but you're
sit.
not totally sitting. You know what I mean?
Yes,
And then you
yes.
kind of walk it up and walk it down.
It's such a it's that's more, I would suggest that's more of a leg exercise, but
Okay.
it might also work pelvic floor. I
Okay.
haven't tried doing that. Check with yourself, stand up against the wall and do the exercise. Do you engage your pelvic floor? Now that you know how to find your pelvic floor, do you engage your pelvic floor as
Okay.
you do that exercise? That's the question. And if you do, then yes, it's a pelvic floor exercise.
Okay.
So anything that you're doing that is core related, to me, that is, although you're holding core solid, technically you should have that pelvic floor relaxed in that one. If you think about the mechanics of the exercise. I think that's what that one is designed for. So, for example, the other thing is, doing a squats are also a great pelvic floor. I didn't include, in fact, I probably have a picture of pelvic floor in here, but squats, let's actually talk about squats because that just reminded me, because that's what you're doing basically, right?
That's kind of what I was thinking, like any kind of squat.
Yes.
Yeah.
Yes, and I did not put a squat in here. Okay, that's fine. So let's talk squats because that is a pelvic floor exercise.
Cool.
And you can do it if you're not comfortable, you have knee issues, you can do a squat um, the way you're talking about and make it work as a pelvic floor exercise, right? So
Okay.
now you have the wall and you don't have to go down as deep. So you have the wall as support and down, not down as deep. A beginner's squat can be doing it from a chair. Think about it that way. And as you come out of the chair, what you want is to have your feet solid underneath you and lift from the pelvic floor and core, right? So that's how it's a pelvic floor exercise. If you are comfortable and have good knees, then your squat remember the most important thing to protect your knees is to make sure that your knees and your toes are going the same direction. It's the same rules I use and apply towards lifting. Your knees, nose, and toes should all be facing the same direction when you lift in order for biomechanic correctness to protect your low back. And ladies, we move heavy stuff by ourselves. So it's important to have good mechanics because we don't wait for someone to come and help us, or we just flat don't have someone to come help us. So, either case, having good body mechanics will protect you from injury. So squats are great. Um, if you can do a sumo squat, which is going all the way down where your buttock hits the floor, that's a sumo squat. If you've got good enough quads and pelvic floor, but as you lift, that's what you're lifting is your pelvic floor, as well as using the strength in the front and the back of the muscle. And it's a good idea, especially if you're doing quadricep stuff and adductor stuff, to lay on the floor and relax or to stretch those muscles. And the other thing I love to do after pelvic floor, any kind of pelvic floor or core musculature, is to do child's pose or the prayer pose. I don't know, depends on what format of yoga you follow, but where you're on the floor, your toes are out behind you, your chest is on your knees, and your arms are outstretched in front of you. Again, do not overstretch. I have done it and put my back out. So what you do is you want to start in a comfortable position and then walk your fingers out till you feel like you've got stretch in your low back that's comfortable. When I have people on my chiropractic adjusting table, I oftentimes, especially with low back conditions, I oftentimes have people do that stretch before they get off the table because it really kind of sets everything we're doing. That's a great way to finish. Ability as we age is dependent on what we're doing right here, right now. Where we are working with pelvic floor specifically, but everything we've just discussed builds core muscles, works on leg strength, because the thing that happens as we get older is we lose the power in our leg strength, especially if we have chronic low back issues.
Mhm.
So, or we get a hip replacement, or we get a knee replacement, and we're static for a period of time. And I have, I talk about my husband who ended up with a hip replacement inadvertently after fracturing a pelvis, and he does not get out of a chair like he's had a hip replacement. He's worked really hard to make sure he's built all that strength up, and he still to this day is doing chair squats. So that he keeps it strong, and it really makes a difference. I've been in doctor's offices a lot over the years with his stuff, and boy, what I know instantly someone's had a hip replacement and they never bothered to do the physical therapy to get that power back in their legs. So physical therapy matters. Do it. I always tell people that. It's like, if they'll give you physical therapy, take it. Take the handouts, take them home, because you may need them again. So, and it takes a long time to heal after a hip replacement. So you've got to give yourself the time to mend and build that strength back. It takes a long time after a knee replacement as well. And those are the two most common joints that are replaced as we age. So that's my soapbox on do physical therapy. Are there any other questions?
Interesting
Okay.
because in the fourth trimester, of course, the board I was on, they have sessions of pelvic floor exercises and they focus on that. And I always thought, oh, that's for a pregnant woman, or
Ah,
someone who's had babies, my misconception.
yes,
So
yes.
it's really helpful to know.
And I would say, and that's why it's important to talk about men who don't have babies and have all the same issues minus a pelvic floor prolapse. They're not going to get a pelvic floor prolapse. But the thing I didn't say is that, when the pelvic floor and the core is weak, you're going to get fissures. You'll get a rectal fissure. You can get a vaginal fissure. So there's so many other conditions that are related to pelvic floor issues and core issues that need to be addressed. And, men who've had hernias, um, frequently are susceptible to having other kind of weaknesses, and pelvic floor would be one of them. So I would suggest that it's important on a lot of different levels for both men and women. And that's why as much as I can, if I can add the male counterpart in, I will do my best to do that, because more women do my program, obviously, than men do, but weight is a primary cause of pelvic floor disorders.
And is
Hence,
that right where
why
they,
that's actually that's another kind of side topic regarding this. If you've had a
sorry.
hysterectomy, I want to remind you that the hysterectomy was probably necessary, and if you've lost uterus and ovaries and fallopian tubes, remember that our female organs are space occupying organs. And so now we have weakness, and organs then collapse.
Oh,
And between what happens is frequently women don't do pelvic floor exercises after a hysterectomy, which predisposes them for pelvic floor disorder. And then as they age and our estrogen changes, now they end up with chronic urinary dysfunction, or bowel disorders where everything's leaking because everything's collapsed in. And the
interesting.
trick to this is to be preventive, proactive. You don't want to wait till everything's leaking, and you can't sneeze, cough, or pick up, 3 pounds off your phone off the table without leaking. It's not fun.
Yeah.
So let's be proactive on how we approach it as women. And that's part of what I stand for as a practitioner, is being proactive. Um, and I think, and I try to practice what I preach.
You
And we all
do.
get lazy. We forget to do stuff. We get busy. It's working just fine. And then all of a sudden, we go, wait a minute, taking longer to fully evacuate my bladder. I don't like those symptoms. That means I have to do some pelvic floor work. It's like knowing what your symptoms are for pelvic floor weakness is a good thing, because that way you can give yourself a cue. Sometimes it takes us longer than others to remember what we've forgotten. I think that's one of those things that happens as we get older. We forget what we're supposed to remember, or it takes us longer than we've forgotten. So I remember my mother used to say that. I would tell her something. She goes, "Oh, I know that. How come I didn't think of that?" you know, because she did know it, but she'd forgotten she knew it. So that's what I'm here for. I'll nag you.
We need somebody.
Thank you so much.
Thank you.
All righty. Okay,
Happy
ladies.
Mother's Day to you mothers out
Happy
there.
Yes, happy
Mother's
Mother's Day.
Day. I should have
Yay.
remembered. Happy Mother's Day, everyone. Dog
Yes.
mothers, people mothers,
Mhm.
everybody mothers. Enjoy whatever you do.